Health and Human Services Secretary Price, who is a medical doctor, made a house call today on Florida to look at the damage from Hurricane Irma. Correspondent Peter Doocy was traveling with the Secretary. He's in Miami tonight. Good evening, Peter.
Good evening, Brett. This morning, we went with Secretary Price to a part of the Florida Keys where residents are still being warned not to come back unless they are prepared to live without water, fuel, and power for a while longer. But anybody who is there and finds themselves in trouble now has a working ER in a very unlikely place.
It's got doctors, gurneys, and a pharmacy, but it's not a normal hospital. It's a patchwork of tents in the parking lot of City Hall in Marathon, Florida, that took just 3 hours to build.
We've got folks in here from New Hampshire, from Connecticut, from Maine, from Pennsylvania, all of them donating their time.
These disaster medical assistance team tents can treat up to 250 patients in a day.
Thanks for your work.
Who otherwise wouldn't have easy access to emergency medical attention after Irma.
One of our hospitals down here in the Keys got a lot of damage. So they've been a godsend to help people.
And even though Irma is long gone, the governor expects coming days to bring increased traffic at this temporary triage facility.
I hope that nobody gets hurt, but unfortunately people do when they're getting back into their homes and checking to see what happens.
Secretary Price says new concerns are arising from illnesses caused by mold, mosquitoes, and dirty water, which would be an evolution from the kinds of things one doctor, a pediatrician from Boston, told us he's been treating so far in the hospital tent.
Just a lot of people who are tired, run out of their medicine, sick. A gentleman this morning that was very nervous and anxious about what's going to happen to him. Some older adults that I typically take care of, lacerations.
Floridians weren't just displaced from houses, but also nursing homes and assisted living facilities. So today, Secretary Price also visited a shelter for people with chronic illnesses on the Miami campus of Florida International University, operated by the Public Health Service Corps, where he committed long-term federal support.
As long as the local folks need us, we'll be here.
Harvey and Irma have kept the feds busy, and Hurricane Maria may soon be on the way. But Secretary Price says he's not worried about resources being stretched too thin and interrupting services at temporary hospitals like the one he visited today.
These folks who volunteer here, they do so on a 2-week rolling basis. They can stretch that to 30 days, but they're in it for their fellow American.
Most of the medical professionals we met there in Marathon were from New England, so they're a long way from home, and they have no idea when they're going to be back to see the family and friends and pets they left behind, because most of them tell us they expect to soon be sent to wherever Hurricane Maria makes landfall. Brett?
Amazing. Peter Doocy live in Miami. Peter, thank you.